Chuck Todd on the beat. What's going on, Chuck?
Well, Dylan, as you said, look, yesterday you had the Senate Democratic leadership over here last night with a meeting with the president. We heard from Speaker Pelosi yesterday, and you can hear in an interview with Andrea Mitchell, take a listen at how she seems to be almost questioning a little bit on the term public option. Take a listen.
Everyone has their little catchphrases. Public option does not reign as the great choice of words, but it does have an appeal with the American people.
Are you going to end up calling it Medicare? Medicare for everyone?
No, I don't think so. But it isn't a question of what it is named. It's a question of what the bill will do.
And it will have a public option.
It will have a public option.
So the question is, will it have a public option? You talked about the opt-in. There's also a version, by the way, there's an opt-out, which could have an opt-in where states would opt in or states could opt out on various things. I know in talking to some that are involved in the Senate process of merging the two bills, when you hear from an Olympia Snowe, the lone Republican that they have supporting some form of health care reform, when you have her saying, I can't support anything that has a public option in it, it does have some at the White House scratching their heads going, well, if that's the case, then why did we spend so long trying to court her if you end up putting a bill together that suddenly she can't support from the very beginning? So obviously you have some progressive Democrats frustrated going, why have we had the entire debate being catered to Olympia Snowe? So all of this is in the crosshairs. Bottom line, I think it's still only 50-50 that any version of a public option ends up in the Senate bill that's initially introduced. That doesn't mean something won't get added in by an amendment. And that still seems to be the debate. It's my understanding Harry Reid wants to try to have some form of it in. But I think the news that Nancy Pelosi doesn't have the votes for that robust public option might actually make it easier for Reid to introduce a bill without it.
The interesting thing, Chuck, is that we can go public option for all day as it stands in every piece of legislation. Even if you got your public option, it's only accessible to the uninsured and the unemployed.
So you're talking at most 12 million people. I mean, so it's a very, and this has been, I think, a frustration of this White House. They believe it is not a central part of the plan, that it's not a central argument of the plan, and yet it is dominating the conversation, and it has become the political hot potato. They'd love to change that, but frankly, I think that genie's out of the bottle.
The problem, I think, is that it's one thing to deal with antitrust, which it's good that they're doing, but if you really want to switch the political hot potato to the employer-based health care system and choice, then you have a serious political problem with the insurance companies, which obviously the White House would rather argue public option than they would reforming the employer-based health care system and choice for all.
And Dylan, we're too far down this process at this point. I mean, that debate should have been 3 months ago or 6 months ago.
For sure. Chuck, thank you so much. A quick programming note: you can watch the rest of Andrea Mitchell's interview with House Speaker Pelosi today on the Andrea Mitchell Reports. Excuse me. That's at 1 p.m. Eastern, right here on MSNBC. We are joined now by Representative Anthony Weiner, of course, one of the most articulate and effective in prosecuting a case for a public option. Before we get to him, let's take a listen to Valerie Jarrett, again, presidential advisor on Morning Joe, just an hour ago.
So by the White House's count, you believe you have enough votes to pass a public option in the House and the Senate?
You know, we'll see. We'll see. I think it's too soon to tell. All I know is that we're going to keep pushing until the very last moment.
All right. Again, Representative, what do you think? Where do we stand with the public option debate this morning?
Well, I think we're going to have a public option. You are right in your intro that there are some conversations about having some kind of an opt-out or opt-in. The bottom line for its effectiveness is at the beginning of the bill, when it first starts, we have to have a public option or else rates are going to keep going up, and any subsidies we provide people won't be enough to keep up with the high cost of insurance. So there's a huge difference. If your listeners hear that they're going to have an opt-out process after a couple of years, that's not so bad. If it's an opt-in process, you're going to have these red state legislatures saying on a political level, we don't want it, and it'll never get its legs underneath it. But I think we're going to have a public option.
Let's educate people briefly. Why is there such a distinction between I'm the governor of state XYZ, you're the governor of the state next door? What's the big difference between opt-in and opt-out? Why should we care?
Well, because let's assume you're Governor Ratigan and you want to make this philosophical point that you're against government-run health care.
Right.
You immediately, the day the bill is introduced, you opt out. Now, if I say that you've got to stay in for 2 or 3 years before you make that decision, pretty soon you have 30, 40, 50,000 of your citizens who are getting this care under the public option. You're not going to tell them, whatever your political stripes are, that you want to leave the program. So that's why it's a difference. The question is how we started out. If we have some kind of trigger that takes us not to 2013 or 2017, but to 2020, we won't contain costs till 2020, and this bill will be a failure.
One thing that I've also been wondering about is you talk about how cost controls can be better achieved through a public option, a version of what we're describing. Obviously, the more deployable, the more effective it would be. In other words, opt-in versus opt-out. Or, is that right? Opt-in is
right.
Yeah. I still don't understand how it creates meaningfully more competition, though, if the only people that can use the public option are the uninsured, maybe the unemployed. In other words, are we overemphasizing the public option when even the most robust articulation of it is applicable to such a small group of people relatively?
Yes and no. First of all, you are absolutely right, and you've been consistent on this point. What we really should do is let all Americans take advantage of that. That's not what the plan does, but here's why it's so important. If we don't have cost containment, then the subsidies that we're providing to Americans to buy insurance won't be able to keep up, and our tax rates will keep going up and up and up because that sliver won't have any choice in competition driving prices down. So it is an important, tiny sliver of competition, but it has a profound effect if we're going to contain the costs of this plan.
And all of this goes, again, whether it's the repeal of the antitrust exemption, which, again, the insurance industry says it doesn't matter. I say, well, if that's the case, why do you have it? This is another version of competition. I guess what still strikes me, and you've been so effective and so articulate and so intelligent in terms of just representing at least this point of view. Again, people could agree or not agree with you, but you've been very effective in presenting the thinking. What still befuddles me, though, not about you, but about the whole debate, is at what point will both Democrats and or Republicans be willing to get out of the kiddie pool, if you will, of philosophical debate and into the big boy pool of the structural situation we have with insurance companies doing deals with large employers, the large employer system incentivizing basically overspending. You know it. A lot of people don't understand this. I'm honestly quite certain that you do. And when will we see a real political debate about releasing the employer-based system from its shackles, which basically create so much of the overspending, whether it's widened choice or 10 other ways to do it? When do we get out of the public versus this and that and just go talk about the employer-based system and its expense, et cetera?
You're exactly right. I launched a website, countdowntohealthcare.com, where we address this, and we also talk about the idea how many members of Congress take advantage of their public option, which is Medicare. But you are right. What we should really do, if we want to ensure choice, we should have a plan like Medicare or Medicare Junior that anyone can opt into, that has low overhead, much lower than the insurance companies, that doesn't pay for profits and overhead. You know, you've had on your show a few times the lobbyists for the healthcare industry. We're paying that guy's bill with our high premiums. Why is it we want to put healthcare dollars into lobbyist advertisements and overhead?
Yeah, and we'll come back, and I know that you and I have it. I feel fortunate I get to talk to you every couple of weeks about this. But again, why is it? I don't understand why. What is it going to take to deal with we as a generation have big problems. Okay, as far as I can tell, economically, we owe a lot. We don't have a lot. We need to become a much more efficient system in general. Healthcare, energy, education, defense, pick them. We've picked up, the politicians and the leadership in this country have appropriately, in my opinion, picked up health care, but are still diddling around the edges, even with the exchange and the public option, and won't go to the guts of the matter, which is where we're blowing all the money, which confuses me.
Well, look, you're exactly right. I have the same frustration. I'm going to get a chance to express that voice on the House floor. We're going to say we have Medicare for people 65. Why not 55? Why not 45? Why don't we have true competition to drive down costs? Look, we are taking on the healthcare industry, and we're fighting over a tiny sliver of competition. And even that, they're putting all of their chips on the table fighting back. Right. But I'm with you. I think we should have real true choice, and we have to ask a fundamental question. Every year, $230 billion in overhead and profits for the insurance companies. What are we getting for that? Why is that a good thing? What is it? It doesn't get us a single checkup, a single operation, or anything, and yet that's what we're fighting to protect. It's mind-boggling.
All right, Representative, thank you for your time and for your efforts, and particularly the education, not only for people like myself, but so many, I think, that get a chance to hear you. So thank you.
Thank you for having me on.
Next on